Hello, my name is Emma Skye and I'm Director of Yale World Fellows and co-host of the Good Society Forum. And the Good Society Forum is a community of change makers from around the world with a common quest to build the good society. My co-host is Nizamuddin of the Prince's Trust and a 2019 Yale World Fellow. Niz.
Thanks so much, Emma, and hello everybody. Good afternoon here from London, where I am, and thank you very much for joining us and being part of our global community that is dedicated to building the good society. As is now custom, you will know we are on various social media channels. We would love for you to join us on those to hear about what we're doing, and also for you to share with us your ideas on how we can improve the Good Society Forum and what other sessions we should be talking about as this world of ours becomes ever more complicated. We are on Twitter at GoodSoc Forum. We will put them on the chat for you to know. We're also on LinkedIn at Good Society Forum, and we have a Facebook group as well. So please do follow us, and especially if you have ideas for sessions or want to be a panelist, please do email us at info@goodsocietyforum.com. So the plan for today is that we have a stellar lineup of speakers. We're going to hear from them first, and then we're going to be taking your questions. If you do have questions, please do put them in the chat box as they appear to you, and we will make sure they are responded to. Just in case there's any technical issues, we know Zoom has had some problems today. Please do bear with us, and we have a brilliant team working with us to make sure things are running swimmingly. So as is now custom, we would love to find out where you are all from, who's joined us today. If you are happy to share, there we go, we've got a couple of people who already know the drill. We have, oh, incredible, we have Michelle from Brussels, we have Rosina from Karachi, thank you. DJ from Belgium. We have Dr. Etim from Nigeria. Hey, great, thank you so much. We have Alfonso from Greenwich. I assume the other Greenwich in New York. You're very welcome. Tina from Jamaica. My goodness, Amelia from Ghana. Don from Bristol. Samia from Tunisia. Dr. Jahan from India. Valentina from Paris and France. Alfonso from Connecticut. Goodness, Emma, how many continents are you counting there?
We're doing well, we're doing well.
Brilliant. And one thing I would say is if you think our sessions are of use to others, we would welcome to broaden our community. Please do share the forums with your contacts, your friends, and your family. And if you're not on our mailing list, please do make sure you sign up to our mailing list so that you find out about everything that we're doing, from our upcoming webinars to other exciting plans that we have for you. Emma, what are we talking about today?
So, over half of the world's population live in cities. And by 2050, that number is expected to rise to 68%. Now, in most countries, cities are where wealth and power are concentrated. And during the COVID-19 crisis, we've seen mayors and governors play prominent leadership roles. So today we're going to explore whether cities are where citizens are now going to look for their leadership, and whether we can expect cities to be the primary engine for growth and innovation, particularly in a post-COVID world. Now, our first guest today is Marvin Rees. Marvin was elected Mayor of Bristol in the UK in May 2016. He's one of the leaders of the UK core cities and on the steering committee of the Global Parliament of Mayors. And he worked previously in public health as a BBC broadcast journalist and radio presenter, and for the International Development Agency, Tear Fund. So Bristol is the first major European city to have elected a mayor of Black African heritage. And Marvin is also a 2010 Yale World Fellow. Marvin, thanks for being with us.
Thanks very much, Emma and Nizam. If I just share a little bit about Bristol. It's a city of about 460,000. We're about 120 miles or so west of London. We're one of the core cities, one of the 10 biggest cities in the UK, wealthy city, but also a city with major challenges on inequality. About 24% of our kids in Bristol are living in poverty, and we hold these two things together. So yeah, it's been a huge challenge for us because many of the inequalities, those underlying inequalities that COVID is exposing, we've experienced in Bristol. But if I just share a bit about how I see this crisis, and that kind of feeds into why I think it should be led locally. First of all, the challenge of political leadership at this time is that COVID is not landing equally across people. It's landing disproportionately on the shoulders of poor people. And in the UK, well-known people from Black and minority ethnic backgrounds. The complexity around that is that the measures being taken to manage the virus that is landing unequally in our communities are also disproportionately impacting the poorest communities. The furloughing, the redundancies that are going to come, the lack of access to food and social isolation, these are disproportionately impact poorest people, so we're hurting ourselves twice over. And then the wicked challenge behind that is that the measures we're taking to control the virus is not getting rid of the virus. So you kind of it takes the wisdom of Solomon to navigate a way through this. I think city leadership needed on this front is something I've believed in from the very beginning. I'm part of the Global Parliament of Mayors, and part of our argument is that the kind of challenges the world faces today, the national governments are just not equipped to cope with them. They don't have the dynamism, the flexibility, the ability to work with the interdependence of populations as they move around the world. They play a zero-sum politics, and that is not that doesn't allow the structures and the space for the kind of innovation and dynamism the world needs on everything from migration to climate change, to inequality, democratic legitimacy, and now global pandemics. But there's a couple of other reflections I'll share with you. In this country, even today in the daily update, the question was asked about should there be a more regional approach to managing COVID, because the reinfection rates are different in different parts of the country, which means that the risks of unlocking our country vary. Government just said no. But here's my concern, is that I just think they fundamentally misunderstood what this is. COVID is not simply a national health service, a health system crisis. It is a social issue because it's a public health issue. Public health is not delivered by health services offering specialist interventions such as operations and intensive care. Public health is delivered through good quality housing, good quality education, supporting parents, good social connectivity. And that is delivered at the local level. National government cannot issue edicts from London, Whitehall, Westminster, and get those outcomes at the level of place. It's about personal behaviours and personal connectivity. And that happens at the level of place where people actually live. All-encompassing statements from London do not deliver that. Secondly, but our Prime Minister has said recently that the approaches to unlocking need to become increasingly complex. And that's been one of the things that's caused confusion in our country. So here's my little provocation on that. You cannot do complexity from one-dimensional statements from Whitehall. Complexity, and I would prefer to call it nuance, can happen at the local level where political leaders know their population and can respond to the micro needs of specific communities where the virus could spark up, and understanding the risks at play. National government doesn't have the nimbleness to do that, and it needs the humility and the self-awareness to understand its tools are limited. It has a hammer, but not everything is a nail. At local government level, we can offer at that movement. There's a flip side to this that I think is particularly dangerous in terms of local government in the UK and perhaps around the world too. That at the moment, our local government finances are being decimated by COVID, and national government is not making up the difference. Unless it does, we could see by default the biggest centralization of power in this country in decades. As is being suggested, a number of local governments effectively go bankrupt as a result of COVID. And that was something that will further undermine the ability of this country to respond to the crisis and the consequences of the health crisis.
Fantastic, Marvin. Thank you so much for your presentation. And Emma, are you there? There we go. Brilliant. Great to have you. So up next, we have our next speaker. We have Ufuk Kahya, who was appointed Deputy Mayor and Alderman in 's-Hertogenbosch in the Netherlands. I think I got that right, in June 2018, focusing on youth, social policies, education, well-being, health, infrastructure, mobility, and European and international affairs. A brilliant brief there. He's a senior advisor for Compass, the Dutch Civil Rights and Liberties Organization, and has experience as a senior trainer on leadership, conflict transformation, community building, and inclusion. He is a member of the Transatlantic Inclusion Leaders Network of the German Marshall Fund. He's a Fulbright alum and a global shaper at the World Economic Forum. So I'm going to invite Ufuk to hopefully speak. There you go, it should be right there.
Thank you for having me. I'm joining in from the Netherlands, 's-Hertogenbosch, the capital of the southern province, Noord-Brabant, where the COVID first appeared. So we were ahead in the Netherlands when coming to deal with this crisis and also with the impact immediately, but also the aftermath. The Netherlands went into an intelligent lockdown, and currently we are having debates and measures on how to intelligently unlock the lockdown and all the consequences of the current situation. So recently, last week, the European Committee of the Regions, which I'm a member of, voted on a resolution to make sure that the support from the EU goes to the regions as well, because cities and regions play a huge role in dealing with the crisis, with the economic fallout, with the social fallout, but also with the question, what's the infrastructure of the future? And that's not only the hard infrastructure, but also if you look at the cultural fields. A lot of initiatives, a lot of companies, a lot of theaters are dealing with hard times, and it will be not possible to keep them all up. So how are we going to make intelligent choices, not by saving first come, first serve, but making sure that we have an infrastructure that can survive the impact of this crisis? And I think this crisis will have several phases. We are entering in different ways, and until we have a vaccine, it will be a society of social distancing. So what does that mean? Unlocking, but not being able to literally hug each other. So what does that mean? Especially for a southern city where we all are a bit cozy with each other and we love to meet up. So how do you deal with the desire of getting together and keeping your distance? There are a lot of great initiatives in the city, but there are also a lot of vulnerable people. So how are we going to deal with that? One of the examples I see is, for example, unlocking the schools. Today, the World Economic Forum published an article showcasing all the different measures schools are taking worldwide to unlock in a safe way, unlock in a way that's COVID proof. And we see the struggle there. We see the struggle in dealing with space, but we also see the struggle of how are you able to make sure that there is equal opportunity for those students and children who are not allocated with social capital, with economic capital, with parents who are highly educated and can help them with their homework, or have enough time to help them with their homework, have the physical space, have a computer, etc., etc. So the inequality in society manifests itself and became more and more clear. So we created a fund to make sure that we can implement measures to make sure that the gap doesn't grow. But if I look at this public health crisis, and I echo the analysis of my colleague from Bristol, if you look at how we deal with public health, recently in the Dutch Institution for Educational Research published a report saying congrats with the diploma of your parents, because there's a correlation of the education of your parents and your life acceptancy. So in a city of mine, within a city in a rich part of the Western world, we have a gap of health in 7 years. So depending on your socioeconomic status, your life acceptancy goes up or down with 7 years. And the chances that you lose your health significantly is 15 years earlier than others. So this is a huge social gap when it comes to health. So this means we shouldn't only invest in healthcare, of making sure that people will get better, but how do we make sure that people are resilient and maintain their health? So this is a big question that we are currently dealing with. I think if I look at other cities, especially in the Netherlands and in Europe, you see that the infrastructure, the local infrastructure, is crucial in making sure that things are possible. So I think local governments and cities especially have a leading role in creating this new society, the temporary, unnormal society of distancing, and making sure that things will be possible. And we have some examples of that in the Netherlands as well, where we see that the mayors of the 25 largest cities are grouping together to make sure that the national and European policies are being crafted in a way that cities have the space to make sure, the wiggling room to make sure that the policies are implemented in a way that works for people. Thank you for having me.
Thank you again so much for sharing your city and your country context. We are expecting Mayor Aki-Sawyerr from Freetown in Sierra Leone, who did join us, and due to, I think, internet connectivity in Sierra Leone has had to drop out. So we're going to change our structure slightly, and over to Emma to introduce our next guest.
So our next guest is Sheila Foster, who is Professor of Law and Public Policy at Georgetown University. She's the chair of the Advisory Committee of the Global Parliament of Mayors, a member of the Aspen Institute Urban Innovation Working Group, an advisory board member of the Marin Institute for Urban Management at New York University, and sits on the New York City Panel on Climate Change. As co-director of the Laboratory for the Governance of the Commons, she is currently engaged in the Co-Cities project, an applied research project on public policies and local projects from over 100 cities around the world. Sheila, thank you very much for joining us.
Wonderful to be here. So thank you. Even though I teach at Georgetown, I live in New York City, and I've had an opportunity to witness both, I think, the failure of our national leadership, which I don't think will surprise anyone, but also the striking leadership that local leaders, that mayors and also our state governors have taken in this crisis. As you know, New York City has been a hot spot. So I just want to offer 3 reflections from the past couple of months being in the hot spot, one of the hot spots in the US. And the first I would say is that we have seen a striking cooperation between mayors and governors at the state level. And I think that's been clear if you've tuned into any of the press conferences, let's say by the New York governor. But I think what's been less clear is that often it's been mayors that have gotten out in front of governors, and governors have often followed their lead. But also there's been some tension between mayors and governors, which is interesting from our perspective as a federalist system in which the national government holds some powers, but not all the powers, and our Constitution leaves a lot of power to the state. But I want to talk about what mayors have done in this crisis, and starting with the shelter-in-place orders. You may or may not know that California, for instance, one of our largest states, has not been a hotspot. And partly that's because the mayor of San Francisco shut down quite early in the process. And in fact, all of the counties in the San Francisco Bay Area did once they identified one of the first instances of what's called community spread in the Bay Area. The governor of California then, of course, shortly followed. In New York, it was the New York City mayor that first called for a shutdown. The governor did not agree at first, but then agreed shortly thereafter. We haven't just seen large cities or large city mayors take the lead. The mayor of Columbia, South Carolina, for instance, shut down his city first, even when the state did not want to shut down. And we've actually seen that pattern. We saw that pattern early on in places like Florida, Georgia, in other words, where the mayors were stepping out front, even when the governors did not want to. And sometimes the governors overruled the mayors. And what's interesting is that now that we're at the moment of reopening, many of our states have reopened, in particular, what we call red states, states that are run by conservative governors or Republicans. But even when they have reopened, there are mayors, such as the mayor of Atlanta, encouraging their local residents to continue to shelter in place because of the risks that remain from infection. So one of the reflections I have is that local leadership is incredibly important, even when you have an emergency that doesn't respect local or state boundaries in our case. Because mayors are in their communities, they're accountable to their communities, and so they have an interest in stepping out in the lead. The second reflection I have is that it's been curious to read that urban density is a cause, or might be a cause of the efficiency with which this virus spreads. And I think that right now, that narrative has been complicated. It's not cities in particular that are risky, but rather it's density in places. So we know that the infection spreads, I think 90% in the US of the infection spreads in the home, workplace, social gatherings like funerals, in prisons and nursing homes, etc. So it's really not urban density, but rather places where people gather. And so this really brings up the question, what will our cities look like in the next year and after COVID? What opportunities do mayors have to create cities in which people can take advantage of the infrastructure of the city? So we see mayors, for instance, here in New York, closing streets so that, or closing streets to cars so that people can get outside and get around and practice social distancing. The parks are reopening, and other amenities and infrastructure of cities in which people can get out and really enjoy the city. So this is, I think, an opportunity for leadership in the post-COVID world, in a post-COVID world. And finally, lastly, I really want to underscore the point of inequality, because it's been quite striking here. So if you just take New York City, it has not been Manhattan that's been the hot spot. It's rather been neighborhoods in the boroughs, such as the Bronx, parts of Brooklyn, parts of Queens, in areas where you not only have communities of color, African American, Latino communities, and immigrant communities, but strikingly, in terms of what I just said before, multi-generational households, where you have a number of people living in one small house or unit. Many of the people in these communities are frontline workers. So while a lot of us have the privilege to shelter at home, and many in New York City even left for their second homes to go to the country, a lot of these communities were sending people out every day to deliver our food, to work in hospitals. They also had to get on public transportation at a time when public transportation was a place of, again, infection. So the disproportionate impact on communities of color, immigrant communities, and low-income communities has been striking. So we really have to think about a society in which, when we say to people shelter in place, number one, that people have shelter. I won't even mention our homelessness problem, and that they have adequate shelter. And number two, that they have access to other public goods that will keep them safe. And in a post-COVID world, again, in terms of inequality, there are a lot of opportunities for mayors to take the lead. So I'll stop there. Thanks for having me.
Sheila, thank you so much for adding that context there. And we will come back to you with questions. And I'm encouraging everybody who's participating to please do keep sending in your questions. And so hopefully this will work. We're now going to hopefully Mayor Aki-Sawyerr will have fantastic, brilliant. I'm just going to quickly introduce you, Mayor Aki-Sawyerr. So we have Yvonne Aki-Sawyerr, OBE. Yvonne was sworn in as Mayor of Freetown, Sierra Leone in May 2018 with a commitment to transform the city using an inclusive, data-driven approach to address challenges in the city. She is a chartered accountant with over 25 years of private sector experience in strategic planning, risk management, consulting, and project management in the public and private sectors. Brilliantly long CV. I'm just going to add one more thing, if I may, which is from August 2014 to October, from October, I believe 2014, led a campaign in the UK to increase international awareness of the Ebola outbreak and recruit volunteers to work in the Ebola treatment center. And in recognition of Yvonne's contribution to the Ebola response effort, was awarded an Ebola gold medal by the President of the Republic of Sierra Leone in December 2015 and made an officer of the British Empire by the Queen in January 2016. Thank you so much for joining us. We know there's been some issues with connectivity. We're really excited to hear from you.
Thanks for having me from the background in order for us to get this connection right now. Thanks for also sharing, I've been listening just to Sheila's point at the end just now. And from the perspective of Freetown, as with many of the West African cities, we're in a different place in the curve of this particular disease. We've just hit the 500 confirmed cases mark. And the rate so far has been slower than the rates in the US. We had our first case on the 31st of March, and we're now in the middle of May, and there are 500 cases. So it's the transmission levels seem to be lower, but the impact is already much higher in terms of percentage of deaths. And significantly from the perspective of the city, we are seeing, as you might imagine, I was listening with interest, Sheila's points about people, particular communities, and their innate difficulties, characteristics which make them more vulnerable to the disease. And what we've seen in Freetown is that we've got particular features of our city. The informality, the fact that we've got 68 informal settlements and 35% of our residents living in slum communities. So think of that idea of not having enough space in a home and shrink that home. Think of people, 11 people, 12 people living in what would be regarded as one bedroom in terms of size, and those being very closely packed together. So our population density in the city is 8,450 persons per square kilometer. Add to that 47% of people not having access to running water. And when you have an outbreak where a major preventative measure is your ability to wash hands, that becomes a real challenge. And another difficulty, I listened as Sheila spoke about people getting onto public transport and therefore being more exposed. 85% of our public transport is single occupancy or small occupancy. So what we call okadas, which are motorcycles, and those are motorcycles where the driver is in front and the passenger is behind, and the only way you stay on is by physically holding onto the driver. So talk about exposure where 60% of our residents are traders in open markets, and where the markets aren't open, well, even where they're open or not opened, there's again a lot of density. So there are features which are built in, and we've got, in our case, a city government of a different political party to the national government. And unfortunately, where this should really not make a difference in a time of crisis, it certainly has. And the level of collaboration between the central government and the city government has not been as good as it should be. That notwithstanding, and maybe in a way, particularly because of that, as a city, we were quite fast in recognizing that it was important for us to develop a city-focused plan. So we have a COVID preparedness and response plan at the city level, which really speaks to our peculiarities as a city, speaks to the specific needs of our residents. So features, it's 3 strategic elements: behavior change messaging, behavior change support, and isolation and containment support. Really trying to ensure that those features, because it's the largest urban setting in the country, 40% of urban dwellings or the urban settings in the country are represented by Freetown. So it was really important that we had a plan which spoke to our challenges. So the messaging is very community driven, and that's come out of one of the lessons we learned from Ebola, having communities at the heart, but also really targeting. So you've got the messenger as a trusted voice. So it means across the city, our counselors, community leaders, youth, women, tribal heads, religious leaders as well, but also moving up from across the city, also looking to special groups. So we're working with Ebola survivors who really have firsthand experience of what it means to have to face a disease like that, the stigma, and can really share and be a credible voice to people in the city. But the bike riders, I just mentioned public transport, the market women associations. So with all of that, we have the messaging. But we move on to support. If you don't have water, how do you wash your hands? So ensuring that as a city, we're providing water, accelerating plans we had already under our Transform Freetown initiative to ensure that most vulnerable areas, hygienics, which are known as peripheral health units, as well as our informal settlements, we're accelerating the provision of water and hand wash stations to them. And when I say accelerating, it's not just bringing water in Bowsers because we don't have the piping systems, but it's also thinking outside the box. So we're fast tracking plans we had to introduce rainwater harvesting, as well as tapping into underground streams in these communities. So helping to ensure that people can wash hands, working on our markets to bring physical distancing in, which means, last week, Sunday, we had a drone fly over one of our biggest markets. And we have engineers trying to work out, and we will be rolling it out this week, how to redesign the way the streets are organized. I heard about US mayors also sort of making streets pedestrianized. So we engaged the commercial streets, totally pedestrianized, called reality. Masks are playing a big role in our setting. With such challenges with the healthcare provision, we're really keen to promote the use of locally made masks. And it's a hard sell, but it's something that we feel we need to do in order to have an alternative to physical distancing. It's in many of our settings, it's physically impossible to have the luxury of a meter or 2 meters in between people. So we're really promoting the concept of everybody wear a mask, and it is a hard sell, but we're being persistent. And as a city, we're producing and giving away 120,000 masks. That's 10% of our population of 1.2 million people. Things like urban farming, kickstarting that in some of our slum communities, because government interventions have included already 2 lockdowns over 3 days. And when people live on less than $1 a day, and they only can eat what they can purchase that day, what they can earn that day, it's really important for us to build some resilience. Isolation and containment, the government is quarantining, but there are often challenges with providing food. It's late, doesn't come on time. And in our slum communities, we know if the food isn't there, people will leave those homes and move around the population. It's been really hard when people are asymptomatic to understand that they are contagious and need to stay within quarantine. So we're providing support there. But we are also seeing the isolation beds, the hospital beds, and we had done some projections some time back. We done numbers, we'd used data, we'd done our analysis, and we knew that we're going to run out of beds. So as a city, we're trying to get about 150 beds on stream in the next couple of weeks to have that added onto the government's, what the government can provide, and it will be city run. With everything that I've said, as a city, we've had to really reach out to international partners, to local partners to support us, because revenue has been adversely affected. We were already as a city in a transition period from a very poorly managed city to our ambition for Transform Freetown. So we weren't quite there yet. So what we're doing, we've done because we've been able to get the support of many international partners, and want to use this opportunity to just say thank you to so many. So I think city leadership is coming through in our context, as it has done in so many other places in the world. And I hope that this has given some indication of how we're stepping in to help stop the chain of transmission. It's clearly not exhaustive, but it's a flavor. Thank you.
Yvonne, thank you so much for making the time and giving us such a detailed description of what it's like. It's I think painted a really vivid picture of the challenges that you're facing in your city context, and we're so grateful for it. We're hopefully, I mean, we're hopeful that you can still stay with us during this Q&A bit. We know you might have to go off, so I'm just going to invite our panelists to join us for this Q&A section. And if you do have questions, I know I've seen a few, please do send them over. So Yvonne, hopefully you can still hear us, is that correct?
Yes, I can.
Fantastic, brilliant. Okay, brilliant. So the first question I have is a really, I mean, we've got 4 different country contexts that are being described here, and you've done a really good job in detailing what it's been like for you on the ground. I would just love to get a sense from you in terms of the day-to-day COVID response. What's it like dealing with your national or your federal entity, and how has it been quite a collaborative venture in dealing with this, or has it been more combative? And I think we'll see different, and you know, that might depending on your party context and so on. I'd love to hear from everybody. Yvonne, could we start with you?
Sure. Sadly, it has not been collaborative, and that's particularly painful given that you know, there was so much that was learned by myself and others during the Ebola outbreak, which, you know, should have been fed into this response, but because of politics, sadly didn't. And so we were starved of information, didn't have any sort of, we didn't have any sort of clear platforms or channels of feeding information from the center in terms of, you know, sort of confirmed cases, quarantine, but we pulled. About 2 weeks ago, the government appointed a national head of the COVID response for my city. And that's an interesting concept, but it happened to be somebody that I knew. We were actually schoolmates, and that has actually worked. It's worked because I now have a direct link, and I can call her and say, you know, this is a problem. Sadly, the response itself at the national level is very fragmented. The 4 lessons from the Ebola outbreak, which I always espouse, are as follows: command and control, community ownership, closing the gap between protocol and practice, and track, isolate, and contain the virus. And those 4 lessons are not they're not coming through. I mean, I think the biggest challenge the response is having now is the lack of command and control, clarity of information and data, and also the gap between protocol and practice. So when I say we're providing food to people in quarantine homes, that's because the national response is not doing that. I mean, it was really widely publicized on BBC News on Friday, when people in a quarantine center and an isolation center actually said they were going to walk out because they hadn't received the requisite services.
Thank you. I was going to say thank you so much for that. And I know Amelia, who's joining us from Ghana, can really resonate with a lot of what you're describing in Ghana as well. If I can maybe take that question to Marvin, and in a Bristol and UK context, can you just give us a sense of what it's been like for you in terms of making decisions locally when the country context has been quite different for you?
A few key words I just wrote down. In one sense, local government feels invisible to national government. I also feel that national government simply sees us as a delivery arm of national policy and not a local leadership, democratically elected in its own right with expertise and intelligence. It has starved us of resources, and that resource has been drip fed, so which is a way of having power, right? So at the beginning of this crisis, they said, do what you need to do, we'll back you. They haven't done that. So now we've faced an increase from my city. We anticipate the increased cost of COVID about 29 million. We had additional money of 26.5 million. So you can see there's a shortfall there, but we've lost revenue in our city of 80 million. So the collective impact on Bristol is 83 million pound. The government is not looking like it's going to step up for. And it's been quite frustrating in that sense. Government have just been unreliable. And I can say the national structures they've tried to work around us have not worked, such as areas like food delivery. Just trying to command and control food delivery to individual addresses in the UK from Whitehall is not a good way of working things. It's been quite frustrating. That's not to say that the overarching guidance has not been good. I believe it has, you know, the R numbers, the education, the social distancing, but they would have been better off giving us guidance and giving us the latitude, the power and the resources to interpret and implement that guidance rather than trying to command and control it.
Marvin, thank you. And Ufuk, if we could hear from 'Zertogenbosch and what it's been like for you, given your city context and also your party context with the Dutch national government.
So the Dutch political culture is more consensus-based. So we are in continuous negotiations with the national government about the funds that we are going to receive. So there is a lot of questions about what of the costs that the national government is going to pay. So that's our daily struggle of how much can we invest and what will be covered and not. And what I saw in my city, but also in other cities, that with the rules and regulations of national government, we just find ways to help people. For example, the national government only allowed children of both parents who had a crucial job to have emergency daycare, but there are a lot of children in my city who are not necessarily safe at home. So what we did was creating a daycare for them as well, which was allowed after 4 weeks, but we just did it. One of the other things is privacy law. So the privacy law prohibits me from reaching out to children which we know are not necessarily in safe environments. But we did it anyway. I'm glad to explain why I reached out to those children for their safety and for their well-being. Because if the whole system of checks and balances doesn't work, you just need to step in. So there's this continuous struggle with what the rules are and your responsibility as a local government to basically act for your citizens. So that's one of the things that we are dealing with. But I think that it will become more harder if this crisis evolves into the next phase.
Thank you so much. And Sheila, if I may come to you and also offer another directed question at you, which is alongside that question and hearing your response, any insight on the impact of the pandemic on the stigmatized quote unquote illegals who constitute an important share of the hospitality, childcare and other essential services sector?
Yeah, so on the first question, state and local governments have taken a huge financial hit. So everything that Mayor Rees just described is true here, and our national government has not come in to offer support yet. There's a bill that's just passed on Congress, the House, that will provide some funding to state and local governments, but the executive, the president, and the Senate have indicated that they're opposed to it for various reasons. So I think that's a continuing challenge here. And as I said at the beginning of my comments, there has been some cooperative or some cooperation between the federal government and states. I think it would be unfair to say that there hasn't. But for the most part, the federal government has really reneged on its responsibility in terms of helping out the states and hence the localities. On the undocumented population in the United States, it's really it underlines the point about inequality, right? Many of the workers who are delivering our food, who are getting on the subways in New York, who are providing childcare, house cleaning services, are undocumented. Not all of them, but many of them. There was a movement for people to continue to pay their workers, their in-home workers, even if they weren't coming to the home. Some people did that, most have not. They're not eligible for the federal financial support, the stimulus payment and unemployment that others are. And as I've said, the geography of inequality is quite striking. So one of the boroughs that has been hit the worst, Queens, and I think you see this in other parts of the country as well, is a heavily immigrant borough, again, with multi-generational households, lack of access to health care, all of the markers of inequality. So we don't have a system national, in particular national, although the mayors, again, have taken the lead on this with sanctuary cities and other policies, but we don't have a system that protects those workers and those people, unfortunately.
Thank you, Sheila. And there's a couple of questions here, which I'll so Michelle has, just picking up the question here. City leadership, mayors in particular, are they politically united enough to collectively lobby national government for funds to combat the virus at a local municipal level? And then Mark Gonzalez, hello Mark, welcome, has asked the question. I know Marvin's done a really good job in addressing these questions, but I'd love to hear some from other panelists. In this emerging world where cities are taking on responsibility previously done by state and federal, how are your cities collaborating with other cities regionally as well as globally to have that impact? And I think both of those are about how are cities uniting in a country context and beyond borders to try and challenge maybe state infrastructure. So maybe Sheila, if I can come to you first in terms of the work that you've done, or if you're aware of anything in the state. I know you've just answered that partially first.
I'm sorry, I missed the last part of the question.
So I guess the question was, how are mayors or city leadership in the US collaborating, or even state level, I guess, how are they collaborating to tackle maybe federal inadequacies?
Yeah, so I think a couple of things are going on. One is we have a very strong network of mayors within the United States, the U.S. Conference of Mayors. And they've been collaborating from the beginning and have a record of collaborating. Second, we see the Bloomberg Foundation has underwritten on the issue of pandemics and sharing information with mayors and empowering them. Has really underwritten further cooperation among them. I think that it's not just mayors, but mayors and governors collaborating where that's possible. Again, sometimes they've been in tension on the question of public good. So I really think that for vulnerable populations, including undocumented, a lot of this flows from the states, but there are a lot that mayors can do in terms of giving folks access to shelter, to mask. I mean, so some of the things that the mayor is or has been doing in Freetown, giving out masks and giving out free disinfectant and other materials needed to keep folks safe. That hasn't been happening here on a national level and at a global level across the state. So that's something that I think mayors can do as well. But again, the financial reality of this, of where mayors and states find themselves, is making it very difficult for them to meet those needs.
Thank you, Sheila. Marvin, if I can come to you, because I know you responded partly to Mark's question on how are mayors politically collaborating in say across the UK and then internationally.
I think one of the challenges is that we haven't in the UK got the infrastructure that has organised the voice, the non-Westminster voice politically. That's a challenge we've been trying to take on globally as well through C40, Mayors Migration Council, and these kind of networks that are coming together around these global challenges that national governments are clearly failing to deliver on. Putting that challenge has been it. The spirit has been there, and we've talked about it, and mayors get together and tell each other stories about best practice within their cities. But what our stress has been that we need to do more than tell each other stories and share best practice about what happened in micro communities. We actually need to work out how mayors begin to shape the national and the international policy context within which they work, rather than just being on a receiving end of national and international policy. Because that point made, which is a legitimate point about mayors stepping into the spaces where national governments are failing, you could see that in two ways. One is you could see mayors asserting and moving forward. I think global governance needs to move into its next iteration, and that would involve global networks of cities working together, shaping the context. So you could see that as a surge in mayor influence, or you could see it as national governments have failed, all these bits are falling off, and mayors, because they're in the cities, they have to pick up the pieces. In many ways, you've got the same kind of spread of leadership, but very, very different drivers towards it. One is healthy, one's very unhealthy. I think at the moment we've got the unhealthy version. How we get to the healthy one, is the $1 million question. Yeah? Million's not very much these days, is it? I mean, $1 billion question.
Yeah, absolutely right. And Ufuk, if I can maybe hear your context across the Netherlands and maybe across the European mainland as well.
So 3 levels. In the local regional level, the mayors work really closely together. That's because the Netherlands is such a small country. The borders of municipalities doesn't mean anything for the social movement of people. So we need to work closely together to make sure that the policy is coherent and people understand what the rules are, and that we don't have different sets of how we organize public space, etc., in different municipalities, because then it will become one big mess. So we are working closely together to make sure it's clear, it's understandable, and it safeguards the public health. The 25 mayors of the regions come together and talk with the prime minister and the ministers almost on a weekly basis, depending on the new policies that are going to be made, to make sure that it's implementable, but to also argue for the local interests. So that's quite well organized by now. And I see in Europe that the European Committee of the Regions, where a lot of members are mayors, also come together. They had a resolution last week also making sure that, especially in those European countries where there is no collaboration between the national government and the cities, that Europe pushes for a more city and region-based approach in dealing with the crisis. So in that sense, I'm quite lucky in the political structure that I'm working in, but I see that in other countries, it's way more difficult. And there's also some practical approach to it. So for example, my city is a sister city of a Belgian city, Leuven, and they sent all their inhabitants masks. So we reached out to them to see what their approach was, how they created their reusable masks, to make sure that we can implement that policy as well, because we need masks in public transportation and in public space as well. So it's happening on multiple levels, but I see that in some European countries, it's a huge problem for local cities, especially if the mayor is not from the governing coalition. There are some troubles there.
Thank you, Ufuk. And I think we've lost Yvonne due to the tech. There was a few questions for her directly in a Freetown context. So there's a question here from Wei Du around any guidance. I think this is quite a practical question, which is great. I'm interested in any guidance that various cities have released for public space. And I think this is directly in relation to you being able to navigate public spaces and during COVID. And I guess as we start allowing people to gather, is there any guidance that you would recommend, and especially ones with a robust coherence and evidence-based approach? Marvin.
We're finding this quite difficult now, because we walk that tightrope of people going out and wanting to mix. I mean, our message has been just continue to stay at home. We're not wanting to mix it up in the city. Continue to stay at home, continue to work at home, because again, I just think that the ability to take in and process the nuance is not necessarily there. And then I would suggest the gains that government have been trying to get by releasing the lockdown could be pursued other ways. They want to boost the economy, announce some major infrastructure investment projects, train stations, low carbon transport networks that are coming down the track. That would give us economic confidence and and economic hope. Issues in mental health, then boost the amount of resources available to public public health services to be able to working in new and different ways to reach people who are isolated, support us with our domestic violence work, because we know that domestic violence rates are going up. I think it's got a little bit too complicated. If I could just say one small thing, which is a bit small, I did suggest to people they walk on the left-hand side of the road, go with the flow, just to try and reduce the likelihood of people walking into each other on the pavement. I haven't seen much of it, but hey, I'm pushing it out there. I'm an evangelist for this one.
Marvin, thank you so much. And Norfolk, if I can come to you, and there's a question here from Asif about the European context, as well as answering that question around any practical guidance that you can offer. Do you think that in a European context, anti-EU sentiment that we've seen, especially in Italy and Spain, resulting from the COVID response, may lead to the end of the nation state as we now know it in terms of European state and lead to the city state? Is that something that's front of your mind?
Well, we discuss small cities with big dreams. I think the nation state will always be there, but amount of autonomy of cities and local government, I think that it will be broadened, or we will just, do stuff and make sure that we are able to do stuff. And I think that debate is not. I think on what I see in the European Committee of the Regions is there is this big debate going on to how to empower regions and cities, especially when the national governments aren't helping out. So when they are not part of the solution, there are resolutions being made to just basically bypass them with European funds to make sure that cities are enabled to act as they are closest to the population and are closest to the solutions mostly. I want to give a short shout out to Samia Melki from Tunisia, who talked in the chat about volunteers. Currently in my city, one of three inhabitants are volunteering. So it says something about the social resistance and also the social collaboration in the city. One of three people are currently doing volunteering work. So that's really important also in creativity and making sure that you can enable stuff to happen. And when it comes to practical things in public space, so my city exists for 900 years. So especially in the city center, we have really small streets, etc. So we started to make sure that they are one-way streets. So we have more space for that. We turned the hierarchy of mobility, so basically pedestrians, bikes, etc., etc. Schools are opening up in the Netherlands, which means that under 10 kilometers you have to go by bike to school and not take public transportation. This raises two questions. One, making sure that luckily we have a good bike infrastructure, but making sure that people can bike safely. That means lowering the limits, the speed limits of roads, so it makes more space for bikers and pedestrians. Secondly, changing the software of the traffic lights, because we don't want bikers to pile up in front of traffic lights. So it will be more green and less red to make sure that bike flow, especially during the morning and the evening when schools are opening and closing, bikes have priority. So this kind of small adjustments we are currently implementing, but we are also thinking of how to organize the public space in a way that people can literally breathe.
Thank you so much. I'm really conscious of time. So Sheila, I'm going to come to you in a second, but I do want to highlight something that Dr. Colleen Thuers, and I hope I pronounced that right, Dr. Colleen from the Open Society Foundations has said, which is to laud you in particular, Marvin, for the work that you've done. So may a city successfully advocate for the inclusion of non-discriminatory access to public health and public education in the Global Compact on Migration, and made a really important point about, and I apologize that we weren't able to go to you, a really made an important point about the need for immigration reform, which happens at a state level, but then often cities are having to deal with the consequences. And so I want to leave on a positive in terms of you all and ask a question around, we know that there are challenges being clearly raised by each of you in terms of your city context, but there's obviously ample opportunity. And we've had a question from Mark right at the end here, which I would love to ask everybody, which I will just get up, in terms of how would you each like to see the physics of power in your region shifted? I.e., how do you maximize this opportunity of COVID-19 to get the city power? And Marvin, you talked about the power of the local and understanding the local communities right at the beginning, which was really powerful. So how do we shift it, and what does that shift look like for you? What is that world as it should be that we're creating, and then how do we get there? And I guess just the vision right now would be a brilliant thing for us to leave with. So Ufuk, if I can come to you just as succinctly as you can, what is the vision for the city, and how can we get there through COVID?
Basically making sure that we can enable as much as possible in regards to public health, and making sure that the national government gives the funds for us to be able to act.
Thank you. And Sheila, if I can go to you next.
So one of the things I think that's really encouraging is the regionalization of power here, because of, so Marvin talked about the paradox of not having a strong national response. But one of the things that's done is, I think, empower governors, at least, and I would say also mayors, to get out in front and to work together and to show that it can be done at a regional level. And I suspect that that's a real inflection point for us here in the US.
Thank you so much. And Marvin, the last word to you. 1 second, you're on mute. I will unmute you now.
Okay. It's just that piece. I just don't want to see national or international policy happen without the input and leadership of cities. It's, you know, we're not just local leaders. We are global leaders with global populations. I have 180 countries of origin in Bristol, with people who have an interest in Somalia, in Uganda, in Pakistan, United States, Jamaica. This is our city. So we need that governance to move into its next iteration, where we are equal partners in shaping national and international policy.
Fantastic. Sheila, Marvin, Ufuk, and Yvonne, who had joined us, we're so grateful for your time. This is in 1 hour, we're never going to do this conversation justice. We hope we've scratched the surface enough for people to try and understand the absolute potential in this conversation of city leadership, especially in a post-COVID world. We're thankful for you and to you for your leadership, and thankful to you for joining us today. And the conversation will continue. If you go on the chat function, you will see our various social media platforms. We will carry the conversation on, and we hope to take it further. Thank you so much, Emma.
And thank you very much to our audience for participating, for all the questions that you sent in. So please join us on Wednesday at the same time, when we're going to be looking at campaigning for election in a post-COVID world. Thank you all.